Hey everybody, so today I'm joined by Bella and Sidra, who are two dental scholars here at Interfaith, and I'll let them introduce themselves.
Hi everyone, my name is Sidra. I'm one of the dental scholars here in the clinic. I graduated from UC Berkeley last spring, and during my gap year I decided to take on this position before I start a dental school in July. And it's been a great position, and it's helped me learn more about the dental field.
Hi everyone, my name is Bella and I'm the other dental scholar. I recently graduated from the University of Tennessee, Knoxville this past spring, and I've decided to work at Interfaith through my gap year as well. Interfaith has been a great opportunity for me to learn the front and back end operations of the dental field and just kind of help me figure out what I want to do.
Yeah, so today we're going to dive deeper into understanding the diverse cultural backgrounds of patients we serve, including their traditional health beliefs, dietary habits, of their dental health, and communication preferences. So we'll start off with asking, what are some techniques you use to approach patients that have reservations about healthcare practices?
Yeah, so here at Interfaith, we try to be really mindful about the different cultural backgrounds of our patients and how that might shape the way they feel about certain procedures they have done to them here. One of the tools that we kind of use to help bridge the gap between patients and their communication is motivational interviewing, and this is a 5-step process that we use. The first step in this process is expressing empathy, and so one of the topics that we talk to a lot of our patients about is about getting vaccinated. And so one of the ways we might help express empathy is saying, I understand that getting vaccinated can be a personal decision, and then asking them what are their thoughts and feelings about this, just to get them to kind of open up about it, because a lot of times it's not about them actually getting vaccinated, it's that they have a lack of information, or they might have had a traumatic healthcare experience in the past that kind of sways them from getting vaccinated. The second step is supporting self-efficacy, so we want to make sure that they have a decision in this, and just kind of reassuring them that they identified some concerns and shows that they're proactive about their health, and then maybe asking them if we can help assist them in finding reliable information. The third step would be exploring pros and cons, and so we would just kind of bring information to them about both sides of the decision and have them identify pros and cons for themselves about whether or not they want to get vaccinated. And then the fourth step would be asking open-ended questions, so maybe asking them to tell them more about their experiences about getting vaccines, and just kind of help, that will help guide us to ask them like what they want to do in the future, and then just kind of help give them information, will help them make a decision. And the last step just be acknowledging no matter what they choose, we respect that they make the right decision for themselves, and telling them that we appreciate their willingness to even have this conversation.
Yeah, that's great. And I know you answered 2 of these, but I also wanted to know, a lot of patients are hesitant about fluoride treatments, x-ray machines, and vaccines. How would you approach a patient that has these hesitancies?
Yeah, so that's a great question. I would probably definitely go back to the motivational interviewing tools, and for those ones, I definitely want to bring information to them and then help them explore the pros and cons. And then another big step is also just using a lot of reassurance, so just reassuring them with fluoride that it is something that's naturally made in their body, and then when it comes to getting x-rays, we just reassure them that we have good equipment to use when they're getting x-rays done to help limit kind of their exposure to harmful rays.
Great. And the next question would be, how have you all navigated language and cultural barriers in the workplace?
So we do have a really large Spanish and Arabic speaking population base here at Interfaith Dental, so it's important that we do cater to their needs as well. One way that we do this actually is implementing these languages in our phone tree system in order to help them navigate our resources in an easier way. It's proved to be very effective since we recently implemented it and have seen enormous success so far with it. When they enter the clinic, we also use language line solutions to help with the interpretation of over 25 languages. It's an iPad built on top of a rolling cart, and we can easily just roll it into any of the operatories at any time, especially during dental procedures, so that the doctor and the dental assistant can communicate with the patients more effectively. It has an interpreter on the other side and really makes it easy to break that language barrier and connect on a much deeper level with patients. Additionally, it's important to be patient with individuals who come into the clinic and don't speak English at all. They're already in a really vulnerable position and need empathy from our side to feel comfortable enough to open up to us. Acknowledging that the pain that they're going through and regardless of their background creates an environment for us to effectively address their problems, especially as future healthcare professionals. Also, with the help of Camden here, we've used artificial intelligence to create videos in Arabic and Spanish that relay oral health information to patients. We've been actually playing these in our lobbies in the clinic for the past month, and I've already gotten lots of great feedback from individuals, and Camden can go a little bit more into depth on the process of the whole thing.
Yeah, so coming into Interfaith, as part of my human-centered design project, I wanted to enhance patient communication, specifically in the communities that haven't been tapped into yet or as much. And as Sidra mentioned, Arabic speakers make up a large portion of our patient base, and we haven't been able to reach them quite as effectively as we've been able to reach our other two large patient bases of English and Spanish. I decided to implement artificial intelligence in the form of creation of familiar-looking avatars and translation programs, which have jump-started our path to being able to create informational videos that any community can connect with. And with the continuation of this, we hope that all of our techniques and practices will make it easier for people to receive more effective healthcare, and we are dedicated to, as future health providers, to make dentistry equitable for the future.